Good day everyone, I am Marian Joy Bilusbog and I am the last reporter for the topic Special Kinds of Wounds. I will now continue the discussion of Miss Laison and Miss Malubay with the letters I, J, and K. So without further ado, let's get started. To start with, I will discuss first the eye wound. So what is an eye wound? An eye wound can be bruised or cut by direct blows or by sharp fragments of metal, grit, and glass. All eye injuries are serious as they can affect the casualty's visions, and every eye injury should be given a medical attention. Even superficial grazes can lead to scarring or infection with the possibility of permanent deterioration of vision. There are 5 things to discuss about this. First, we have the bandaging methods. So what to do? A. Loose bandage if eyeball is injured, and B. Firm bandage if tissues around the eye is involved. Number 2, foreign bodies in the eye. So, for your information, a foreign body is an object in your eye that shouldn't be there, such as a speck of dust, a wood chip, a metal shaving, an insect, or a piece of glass. So, the common places to find a foreign body are under the eyelids or on the surface of our eye. So first, the dangers. So there are 2 dangers, and 1, vision sometimes is seriously affected. Number 2, foreign body may become embedded in infection and vision damage occurs. So this happens when the eye wounds are severe. Letter B, steps to prevent serious trouble. So what should we do? Number 1, we should never rub our eye. So number 2, never examine the eye until you have washed your hands thoroughly. So it is very important to wash our hands first now to avoid the wounds of getting worse from the bacteria we have in our hands. Number 3, never be rough in handling. So we should always be careful in touching or treating the eye wounds. Number 4, never attempt to remove a foreign body with a toothpick, a match, a knife blade, or any instrument. Number 5, never fail to send the patient to a physician if the foreign body is embedded in the eyeball. See, we have first aid treatment. First, removal may attempt if foreign body is not embedded. Number 2, irrigation with boric acid solution. So a boric acid ophthalmic for the eyes is used as an eye wash to cleanse or irrigate the eyes. And number 3, if removal is unsuccessful, what should we do in case? So A, put several drops or any heavy oil in the eye, such as olive oil, castor oil, or mineral oil. Letter B, send the patient promptly to a physician. So we will also talk about the wounds or tissues about the eye. So A, apply a pad of clean cloth or gauze and firm bandage. And letter B, send the patient to a physician immediately. 4, wounds of the eyeball. So any kind or any eye wounds can be serious even if it is very tiny. A, don't remove any splinter which penetrates partway into the eyeball. Letter B, we should keep the victim flat on his back. C, apply pad and loose bandage. Letter D, take to a physician immediately. And lastly, we will talk about the red eyes. So what should we do about this? So A, cleanse the eye with boric acid solution. B, apply hot compress for 5 to 10 minutes. So the heat from the compress helps the glands that produce tears to work better. Alright, now let me discuss to you the important keys of nose bleeding. So what are the causes of nose bleeding? A, nosebleed often occurs spontaneously, particularly in children or in adults, and to those individuals who have high blood pressure, and it also may start without any injuries. Letter B, frequently follows injury like broken nose. And in addition, if you tend to pick your nose or blow your nose frequently when you feel stressed or anxious, that could also trigger a nosebleed. And any situation such as pregnancy, travel to high altitude, extreme sports, or any physical trauma, it can all bring on anxiety and nosebleed. And now, how can we treat nosebleed? So the second one, we have the first aid treatment. Usually, treatment is not necessary, but if bleeding continues, it can be stopped by any of these methods. Letter A. Make the victim sit up with his head thrown slightly back, breathing to the mouth. Loosen his collar and anything tight around his neck. Letter B. Apply a large cold wet cloth over the nose. Letter C. Pressing the nostril on the bleeding side firmly against the middle partition, because it often stops the bleeding and it provides opportunity for a clot to form. This method should be done at least 4 to 5 minutes to be effective. Letter D. If these measures don't stop the bleeding in a few minutes, a doctor is needed at once, and meanwhile, gently pack the nose with rolled gauze, but it should not be cotton. Letter E. Have the victim avoid activity blowing his nose or coughing for a few hours. Now let's move on to the last part of our discussion. Letter K. Internal bleeding. First, what are the common sources why internal bleeding happens? We have here 3 common sources. And letter A, the lungs. So tuberculosis is the most common cause of spontaneous bleeding, and puncture wounds particularly is when the rib is broken and driven into a lung. This will occur a bleeding. Blood is coughed up and is bright red and frothy in appearance. We also have here B, stomach. The most common causes are wounds of the stomach and stomach ulcers. Blood from the stomach is usually vomited up and has the appearance of coffee grounds. Digestive juices begin to act on the blood, causing it to turn brown and break up into small clots about the size of a large coffee ground. C. Bowels, particularly in the intestines. So diarrhea and dysentery are the most common causes of bleedings from the bowels. If the bleeding is from any point fairly high up, the blood is bright red on the stools, and the bleeding is from the point low down in the bowel. At this phase now, let's identify the symptoms of internal bleedings. Letter A. In any of these conditions, the 3 chief symptoms of early hemorrhage present before any external evidence of hemorrhage are restlessness, anxiety, and thirst. Letter B. Particularly accompanied by pallor, weak rapid pulse, and weakness evidence of shock. And lastly, the first aid treatment that we can do, and all of these are the same in all cases. First aid treatment. So A. Keep the patient lying on his back as flat as possible or with the feet elevated. Turn his head to one side for vomiting or coughing. Now letter B. Keep the patient absolutely quiet. Letter C. Keep the patient warm. D. Reassure the patient. Badly scared increases circulation. Letter E. Call a physician immediately. Letter F. In chest injuries, lung has been punctured. Prop up the patient high enough to let him breathe. So that ends my presentation. I hope you learned something from it. Thank you and God bless.